So, first of all, good day for you. I am really, I am with you here. You have no idea how long I've been dreaming about this. I've seen you, and I've seen Dr. Roger Callahan. I've read his book. I've seen your work, and it is very exciting for me to be here, sitting with you, and also planning for our next course that's gonna be in Kuwait. But before we go through all of that, I want to ask you about um, TFT. For those people who don't know TFT, what is it? What is TFT? When did it start?
Well, first of all, thank you for having me. I'm excited about coming to Kuwait. And TFT started 37, 38 years ago as the Kalhan techniques, when my late husband, Roger, was constantly looking for better, faster ways to help his clients. He was a clinical psychologist, a pioneer in all the early things in psychology, like hypnosis, cognitive behavioral therapy. He was a pioneer in all those early ones, but always looking for something that worked better and faster. So he found through the years of research, he researched kinesiology, meridians, all kinds of things. And as he put some of these things together, he started coming upon ways that quickly would help something. And then he spent the rest of his life developing that and sharing it with others.
Can you just tell me, because I know about the Mary story, but I'm sure that a lot of people would love to hear about it.
Oh, okay. Mary was one of his clients at the time. He was researching different things in acupuncture and meridians and applied kinesiology. And she had a severe fear of water. She had had it since she was an infant. Her parents never remembered her not having it. And he was working on that with her with systematic desensitization and cognitive therapy. And she would be able to get to the edge of the swimming pool and dangle her feet in, but no further, and it would give her a severe headache and she'd feel awful doing it. And they had been doing this for about a year. She described the feeling in the pit of her stomach that she felt when she thought about water. And Roger knew through his studies that the stomach meridian began under the eyes. And so one day he just had her, before they headed down to the water, he had her tap under her eyes, just like this. And she looked at him and she said, "It's gone." And he said, "What's gone?" He wasn't expecting it. She said, "That terrible feeling in the pit of my stomach." And then they went right down to the pool, she eagerly leading the way, and it was gone. The fear was totally gone. It made no sense to him from what he knew of psychology at the time, but the fear was gone. And he then started testing and working with many things to develop and find how to make that kind of thing work for everybody and for all kinds of problems. Mary recently has been in touch with us. Mary still has no fear of water. Every once in a while we get a postcard from her from a cruise ship, on a cruise or something like that. So it's held up all these years. And unlike most scientists, he didn't just disregard it as a fluke coincidence. He knew something significant had happened there. So then he began trying to find out what and how to replicate it. And that was the beginning of TFT. And it's basically, he's found ways to identify which meridian systems are out of balance and in what order, and how to determine the specific tapping sequence for that problem.
What fascinates me about Dr. Roger Callahan, that he was, I think he was a professor in the university also, and he also was open to different kind of modalities. That's really
Yes.
keep me going, I learned TFT, I learned other stuff. I'm open to all kind of, healing modalities. I've tried a lot of them, but I never had this profound results as much as TFT, because first of all, it has an immediate effect on people. Second, they can go and apply it by themselves. They don't need me to
Exactly.
teach them again, to have the session with them.
Exactly.
So what is TFT? What does it stand for?
The initials TFT stand for thought field therapy. And that's basically the tuning of the specific thought field while addressing the meridian systems.
Okay. So it stands for thought field therapy. You go into the thoughts, whatever you're thinking of, and then you heal it by doing certain steps.
You correct the perturbation or balanced the data within that thought field by addressing the meridian system in specific orders. And it's his diagnostic process that allows you to determine what that order is that's needed.
So now that brings us to the other question that a lot of people love for you to address, and I think I've been asked a lot about it. What's the difference between TFT and EFT?
The difference is that EFT, we trained Gary Craig in 1994, and he took the algorithm levels and put the algorithm all together in one long sequence. It's kind of a shotgun approach. It's simple to use, however, it's very limited in that it doesn't have the diagnostic process. TFT, all the algorithms, including the ones that were put into EFT, actually came from that diagnostic process, determining that specific order, being able to identify what the reversal or block to healing was, or being able to identify a toxin. That is the diagnostic process. And that's what gives us those precise sequences. So EFT is at the algorithm level, which, like TFT, has a lot of success with the algorithms or common tapping sequences. What happened is over the years of treating, after EFT didn't come along until we trained Gary Craig in '94. That was 15 years after Roger had been doing this. And it just so happens that there's common patterns. Like when you're working on a fear, for instance, there's a common pattern. When you're working on trauma, there's a common pattern or tapping sequence that will work for a lot of it. But when you have complex problems, multiple problems lined up there, or many years of layers, you need to be able to diagnose specifically what meridians to address and in what order. You also need to be able to specifically identify the blocks or reversals to healing.
Okay.
So EFT is basically a good introductory level.
Yeah, it's a good introductory level. First time I knew about tapping, I knew it from EFT. Sometimes it's not working. So I wanted to go further. Then I learned about the TFT, the original treatment. So the difference between, so that everyone can recap on that. The difference between EFT and TFT is that our TFT, that the one we're working on, is have the diagnosis criteria. It will figure out the blocks, the reason why it's not working, and will solve it for you, right? So the percentage of success is much, much, much higher.
Yes. And the level of complexity is much greater. that we can deal with.
Qualifications. I know you've been in TFT for more than 30 years, but tell us more about that.
My qualifications, I actually do have an MBA in healthcare administration. But most importantly is I worked side by side with Roger in co-developing TFT, and I was the one that actually created our training program. So I've been doing it for over 30 years now, and I teach other professionals all over the world. And what we find is that as we train our trainees, they then come back with their problems. So we're in a position Roger has always been in, and now I'm in the position of being able to work with the most difficult things and help our trainees problem solve those. So we get very complex things, and that's how we develop and grow and expand TFT.
Yeah. One of the main reasons that I wanted to have you here in Kuwait is that you have the experience, the knowledge and the experience, and you've been through it all. You've seen a lot of people, a lot of problems that you can give us the gist of it in the training, so that a lot of people that's gonna learn is gonna learn the right way. They're gonna the time, you will have the best of the training. That's one of the reasons that we're gonna have you here. And Joan, can you just recap on the levels of TFT? Whoever wants to learn TFT, he needs to know how many levels are there in TFT, and what are we gonna cover in Kuwait?
There are three basic levels of TFT. The algorithm level, which is what we've already talked about, common tapping patterns that can be self-applied by anybody. Then, and safely, there's never been a case of harm by self-applying these techniques over the last 30 some odd years, 37 years. The next level is what we call the diagnostic level, which means the ability to determine exactly what tapping sequence you need for whatever the presenting problem or problems. And all the algorithms came from that process. All of the procedures like collarbone breathing, reversal corrections, toxin identification, they all came out of that diagnostic process. That is the biggest difference in all of the TFT and EFT and all the other tapping modalities, is that diagnostic process that we have. That's what allows us to create new protocols. And then we have what we call the voice technology level, which allows us to do that diagnostic process using the voice and the energetic systems. And that level is the most self-empowering level you can learn. You can do, it's transformative. People that come to those courses, their lives change, they are transformed. It empowers them to heal themselves. It's like you said, it can be self-applied. It's the most self-empowering. There's a lot of good healing modalities out there, but none of them can be self-applied at this level. And what that does actually is it allows us to go anywhere in the world and teach it to anyone, and it works in any culture because they can use their own culture, their own belief system within that self-empowering healing.
Joan, I've took with you a session. It was, I think, through voice technology. You checked my toxins. You checked. I used to have asthma. I have difficulty in breathing. And one of the sessions, you figured out the toxins. Just to tell everybody, there is some kind of thing that's called individual toxins, energy toxins. These toxins sometimes will prevent the treatment, and sometimes will provoke certain kind of disease in you. So when the thing is, the doctors told me that I'm gonna be on medicine my whole life. You know, I'm gonna use inhaler, I'm gonna use coughing medicine, whatever that is that's gonna lower my anxiety. But when I took it with you, when I took the session with you, and you told me that there are some certain things that I'm using daily that are affecting me. And one of them, I think, was Tide or something. One of the
laundry soap.
Laundry soap, and the other stuff was perfumes. And I stopped them, and all and behold, all my asthma went like from 90% to 10%, and I haven't used inhaler for almost 2 years or a year and a half. And the time that I use inhaler is that the one, you know, when there is dust all over the place. But other than that, I never use it. So that was using, I think, voice technology to check which toxins that I have. Joan,
that's actually that's actually an excellent example right there of the difference between EFT and TFT. In EFT, you have no way of identifying those things specifically. In TFT, you can identify them specifically and very quickly.
Yeah. We promised, as we were preparing for this video, that we're gonna give the people a technique, you know, just to have a feeling of what's gonna be, what TFT is, and I'm gonna leave it for you to choose any technique that you think that's gonna benefit everyone. So
well, my husband Roger always said that the most important thing he discovered and developed was the correction of psychological reversal. The term he used was psychological reversal. And he believed that until the day he passed on. And the reason is that it removes the blocks to healing and allows positive healing flow of energy. So if people got nothing else out of TFT but could remove those blocks, much healing can still take place, emotionally, mentally, and physically. And so we have over the years developed 5 levels of blocks. And even if people did nothing but just correct those, what we call it for short, PRs, or blocks to healing, and just change their thought field so that then one day they're removing the blocks to healing to get over a cold, but the next day they're removing their blocks to achieving their success, to having their business or their best relationship or something like that. It's being able to remove those blocks that are still probably the single most important thing TFT can do.
So we're gonna apply it now with everyone. Okay. So you're saying that removing the blocks or removing the reversal, psychological reversal, will help in any kind of treatment, not only TFT. And
exactly.
Even using medicine.
Yes. Do we have time for a short example? Do we have time for a short example? Yes, we have
all the time. Just go ahead.
Okay, here's just a perfect example of that. I have, there's somebody here near where I live that I've been helping give them a ride to the chiropractor. They're in their 70s and they've had a bad knee. And the chiropractor has been working on this knee. And this had been going on for about 6 weeks with very limited improvement. When somebody else asked him, so have you been tapping for it yet? And he said, well, no. So I tested him, and sure, there was about 3 levels of reversal. He started tapping, and the knee improved immediately. It allowed the chiropractic treatments to hold, and his knee is now all recovered. So even though he was getting a good and effective treatment, he had blocks, literal blocks in the body's polarity in that area, and it wasn't healing. As soon as we corrected that, then the same chiropractic procedures allowed that knee to heal.
Yeah. I totally agree with that, because I personally used to have, when I have a flu, I will be sitting at home, sitting on the bed for 6 to 5 days, sitting in the bed, cannot move, feeling bad. My body is all torn down. And when I applied one of the best techniques, the collarbone breathing, that I think we're gonna show everyone about it. When I apply it, now when I'm sick, it will take only for 1 day, maximum 2 days, and I'll be back to normal. And sometimes 1 hour.
Yeah, that's another very powerful technique that we'll be teaching in the courses. It can be used in many ways, many different ways, and is a very powerful procedure. So right now, what I'd like to do is show people 5 levels of reversals, and they could just start their day with this, releasing the blocks to whatever they're facing that day. Say they don't feel well, they're focused on, we'll do the tapping, and they focus on releasing all the blocks to healing. But say they have a really important interview, they're releasing the blocks to doing their best, being calm and confident. Or say they have a new date that night, they really want to, they're releasing the blocks to just being a wonderful, loving partner. Whatever their focus is, they want to release the blocks to it, and then it allows the flow of positive healing energy. So let me show the 5 PRs, okay? And they can do a round of 3 of those, actually. Okay? Okay. So the first one is they're going to tap the side of the hand, right here where you would do a karate chop. That's actually the small intestine meridian, and you tap that spot 10 times.
Just one question. Can you do the right? Can you do the right hand, the other hand, because the picture is blocking. Can you use the other hand? Yeah.
Like that?
Okay. Yes.
Do you like that? Okay.
Yes.
So tap. Everybody tap the side of your hand, releasing all blocks to healing or being your best, whatever your desire is. Then we're going to tap under the nose right here. 10 taps. Use 2 fingers. Put firm enough to put energy into that system, but not hard enough to hurt.
Okay.
Now tap the center of your chin, just below the lower lip. Okay, now tap the middle finger on the side nearest where the nail bed meets the flesh. Okay? And then we're going to tap the outside corner of our eyes. And I'm going to put my glasses up right here, where the 2 bones come together on the outside corner of your eye. And you're going to do 10 taps. Now, you can do just 1 round of this, or you can do 3 rounds of it. If you're just doing the removing of all blocks, do it 3 times. And you can do that in less than a minute during the day, first time in the day. But you'll be amazed at what that can accomplish.
So, just to recap, for all of us, for all of you who are watching this interview, one of the best techniques that you can come up, that Dr. Roger Callahan was saying that until the day he passed away. So this is the 5 steps: is tapping the side of the hand while thinking of releasing all the blocks toward whatever you want to do, right? Tapping the side.
Right.
Then tapping under the nose with 2 fingers. Not hard to hurt, not too hard that you hurt yourself, and not too gentle that you don't feel it. Something in the middle, right?
Right.
Then under the lips. It's not here, the lips, right? Just under.
Correct. Yes.
And then the middle finger.
Correct. On the side nearest the thumb. Pardon?
Did I miss anything?
And then, yes,
and then
the outside corner of the eye. That's a new one.
Yeah.
The last two are new. The middle finger one and here are new.
So you guys are having the advantage of getting something new on this video.
Yes.
Okay. So Joan, let's talk about we already know about the first level. It's already been out there for a long time. I've done it like maybe 15 or 16 times throughout the Gulf area, and I have like 150 to 160 students from my side. I know that there are other trainers, but from my side, this year I have all around 160 students doing the algorithm, the first level of TFT. But why would you suggest that somebody go and have the diagnosis level, the second level?
Well, for the very reason that you gave, that you found your toxins and it's changed your life. You no longer have asthma and you can't identify those kinds of things at the algorithm level. You have to have the diagnostic level to determine specific toxins or specific blocks or reversals. And if you have multiple problems, you need a combination of sequences. You can't get that specificity at the algorithm level.
Exactly. This is because I have a group that we are, the whole students are with me all the time, discussing their sessions, what can they do to improve it and everything. And they keep asking me. Sometimes I can help them, and sometimes it's way beyond your level. It's sometimes you need to know the toxins. Sometimes you need to go deeper in the problem because you're not solving the problem, only solving the the first layer of the problem. And so they ask me, so what can we do? I say, you have to go to the second level, or just let them come to me or go to other places. So it's sometimes very complicated because I cannot, or no one can just know what's going on with the person unless he sits with him for hours or use the most simplest way to get rid of all the talking and go to the core problem through the diagnosis level.
Exactly.
Right?
Yes.
Okay. So in the second level, you need to know the toxins. You can get the toxins. You can tell them to. You can tell which problem or which emotions, complicated emotions they are in, and you can give them the right technique to do it and diagnose.
Yeah. Commonly, the algorithms work for about 80% of the people, the diagnostic level about 90%, and then the rest about to 98% on the voice technology level. The difference is the voice technology level is so very self-empowering because it also gives you that level of success on yourself.
So the diagnosis level, I cannot diagnose myself. The second level, I cannot diagnose myself.
You can, but you'd have to have somebody help you push on your arm or use other methods to do that. Learning that process at the boot camp.
If I am alone, I cannot do it.
No, not at the boot camp level. It's geared to work on other people.
But and the third level is the
optimal health.
The voice technology.
Yes, and that you learn everything to use on yourself and anyone else. And you learn the self-testing, the self-treatment, the self-work, as well as the voice technology for other people. But you have to learn the diagnostic process first. It's required because you need that in order to go to the optimal health or voice technology level.
Okay, for the boot camp, anyone can go in, right? It's first level and second level. It's the algorithm and the diagnosis level. So this one, anyone is they can just go in and register and come to the course. But for the optimal health, which is the voice technology, you cannot go in unless you finish the boot camp or finish the diagnosis level.
Right. Correct.
Because there is involved, it's involved a lot of procedure you should know about before you go into the third level.
Right. Right.
People are going crazy with the voice technology. They keep asking me, what is it? Why is it so special? Why is it so accurate? And what is the name of, what is this name, voice technology? I know you need to go into the course to know that, but can you just give us a little glimpse of it?
It's just using the body's voice and energy field to do the diagnosis or diagnostic process with. And energy is much more specific and, shall we say, precise than the physical body. Okay, everything's energy in the end. And when you're doing the diagnostic process, it's like what we're comparing. One of our voice technology practitioners said it this way: the algorithms are like a shotgun approach. The diagnostic process is like a rifle where you can pick and choose whatever, but the voice technology is like using a laser.
Oh, it's very accurate, to the point.
Very precise, very accurate, and very quick.
Well, I am excited about the 3 levels, especially having it with you, because what would it be better? How can it get any better to have it from the source of TFT, you know, the co-founder of TFT? And it will be my pleasure, and I think it will be the pleasure of a lot of people to have you in Kuwait, and maybe in the future we have you in other different countries in the Gulf. One last question I had from my students in TFT. They asked me about especially the diagnosis level, the boot camp, and the voice technology. They asked me about certain diseases. I know you had your share of, you used to have, I think, third level of tumor or cancer.
Stage 4. No, I had stage 4 non-Hodgkin's lymphoma. I had it in my bone marrow and throughout my body. I did no chemo and no radiation. And I have been cancer-free for almost 14 years now. I use TFT and some alternative methods. Yes, of course. In fact, in the toxin section, where we teach them how to neutralize the side effects of necessary medications, we perfected that protocol on me while I was being treated for the cancer. We've had numerous people have very. We have had numerous diagnostic level practitioners as well as ourselves have excellent results with things like MS or multiple sclerosis. We've seen the before and after slides showing the plaque on the brain is actually gone. We have very good, and what we say we do, we're not treating those medical problems. We're helping the body heal itself. We're facilitating the body's ability to heal.
So you're helping with the process. TFT help with the process. Whatever they are doing, you know, going through using medicines, whatever, you're working on the energy level to help them to heal themselves faster.
There's our book, the tapping the body's energy pathways, which has a whole list of different things that people have been healed from it. When I talk about that, I don't want people to misunderstand and think we're treating these medical diseases. We can't do that. But we can help the stress. We can help facilitate the body's healing. We can remove the blocks to healing and from all those things. And so far, most everything that we work with people with, we have had very good success in allowing and facilitating their healing.
Okay. One last question is that boldness. There is a treatment with it with using TFT. Boldness and
we haven't done
obese.
that at all. What?
No. How about weight loss?
Yes, we have a lot of good success with that, and have for many, many, many years. That was, Roger started with that very early on. In fact, it was about weight loss where he discovered the concept of psychological reversal.
Mm-hmm. Okay, thank you very much for this interview, and I hope to see you in 28th. Our course is going to be on the 28th of February. You're going to come before that. I'm going to have the pleasure to sit with you and chit chat with you before that. And the course is going to be from 28th until the 2nd of Mars. This is going to be the boot camp. And the optimal health will be from the 3rd to the 5th of Mars. So it's going to be a total of 6 days for whoever going to attend the 2 courses. And I hope to see you all there.
I'm looking forward to coming and meeting you.
Me too. I just want to say that was a vibrant and entertaining and also informative interview. Thank you very much. You have a strong presence, and I hope that everyone will see that when we are there in the course, because I know TFT has affected me, affected my family, affected my daughter. I hope that you see her, and you'll notice the difference.
Yes.